I'm back after this very brief break. I hope you still have some energy and headspace for this. It will be a very interesting roundtable on mobility, pandemic, and inequalities, and we're hoping to sort of discuss how the various inequalities that have been laid bare in the past year and their restrictions on mobility, how that sort of has impacted on different things. For that, we have three very interesting guests and speakers who will first give a little bit of an input for 5 to 10 minutes, and then we will all have the opportunity to ask questions, and I think we will have a very interesting next hour. First of all, we have Priya Deshingkar. She's Professor of Migration and Development at the University of Sussex. Her research focuses on the links between South and South migration and poverty in Asia, the Middle East, and Africa. And she will highlight the consequences of this new travel and mobility regime in different places of the world, and with a particular focus on India and the Gulf countries. We have Nolwenn Bühler. She's an SNF researcher at the University of Lausanne and a senior lecturer at the University of Neuchâtel. She's an anthropologist specialized in the social study of science, biomedicine, health, and gender studies, and she will address how gender inequalities have been laid bare in this regime of forced immobility. And then finally, Lorenzo, one more time, Lorenzo Piccoli, who is the scientific officer of the NCCR on the move, and he works as a research associate also for the global SIT at the Robert Schuman Center for Advanced Studies in Florence. His research focuses on the multi-level citizenship, with a particular interest on how subnational governments shape social and political rights, and he will discuss the way in which wealth, citizenship, and resident status create differences in how individuals are affected. And he will be the one to kick off the debate because he has a bit of a global perspective on everything, and then we will continue with Nolwenn and Priya. Lorenzo, off you go, and thank you.
Yeah, thanks, Mia, for this introduction. Beautiful panel. For those of you who were here in the previous session, you might have seen that I'm trying to move because I see I'm very dark in here, but I can't shine more than this, so we'll have to live with this darkness. I'm gonna talk very briefly because I think it's much nicer if we have a broad discussion about the research report that I wrote together with my colleague and friend Jean-Thomas Arrighi. And we wrote that report because we were really upset with the sentence that keeps popping up in a lot of articles that are being published around migration and the COVID-19 pandemic. And that sentence is that the pandemic had a disproportionate impact on migrants. Maybe that's the case, but we think this view really contributes to a stereotypical view of migrants. The only thing that migrants have in common, according to the agreed definitions, is the fact of having lived in a foreign country for a period of 6 months. And so just to put it bluntly, the impact of the pandemic on me, I am Italian, I live in Switzerland, and I am an academic and I am a male, has been very different than on a Filipino woman working in Rome as a social care worker. So we think we should really be careful when we speak of migrants and try to understand what kind of effects the pandemic had because of your status as migrant. And we think that there are, of course, a lot of negative effects of the pandemic, either because of the exposure to the virus or because of the consequences of the draconian restrictions introduced by governments, so economic consequences. But they're not because of the status of migrants. Instead, it is because many migrants are overrepresented in social classes that are very vulnerable, or because they tend to take up very precarious occupations, taxi drivers, nurses, waitresses. A lot of them are migrants. But what we want to emphasize again is that the negative consequences on are not to the fact that they are migrants, but they are because they happen to belong, again, to a vulnerable social class or to have a precarious occupation, or as we'll probably hear in the next input, they happen to be women. And so the compound effects of those factors can be very negative. But this is not about the status of migrants. Then there are, of course, direct effects that are due to the fact that you are a migrant. For one thing, people couldn't move, and this is, of course, very important for migrants because mobility is at the very center of their life, since this is divided between at least two different communities, the community where you live and the community where you hold some of your documents, your citizenship, your nationality. And here it is important to see that actually some migrants had very favorable access to certain forms of mobility during the pandemic. Let's think about evacuations. If you belong to some countries and were abroad as a migrant, maybe your government came and helped you out and brought you back home. The other important way in which we should think of the status of migrant in the moment the crisis strikes is access to healthcare. And here it is really important, and very few people to differentiate between the access that is given to you in the country where you live. And here, for example, many countries in Europe expanded access to healthcare to include some categories of migrants, irregular migrants, asylum seekers during the pandemic. Other countries didn't. The US, as you know, Australia, they approved very strict plans that excluded many categories of migrants from social welfare. But it's also important to think of what, again, your country of nationality does for you. There is a very good example, the example of Mexico. The government of Mexico made sure that many of the citizens abroad could access healthcare during the pandemic, sometimes giving advices on where to go in the country where migrants are, some other times putting them in touch with other Mexican doctors so that they could get important. So if we really want to understand the pandemic on migrants, we should probably look at whether governments, again, the government of the place where migrants live and the government where migrants have their documents, give them access to ranges of services, for example, testing, hospitalization, social subsidies, and of course, right now, and I'm surprised we're not still speaking about that, vaccination. We think that taking this approach is a way of making justice to something that a professor of the NCCR on the Move has been defending for many years, that is the idea of demigranticize migration research, and again, not having a stereotypical view of migrants as always necessarily the most vulnerable people. And it also takes seriously the idea that we live in a constellation of different communities, and that your rights, especially as a migrant, again, because you live a transnational life, depend not only upon the country where you are, but also to some other place. And in this way, I think we can unpack a little bit more clearly the way in which the pandemic has affected migrant communities. I will stop it there. Thanks.
Thank you, Lorenzo, for showing a bit the complexities of what it means to be talking about migrants and migration in the context of this pandemic. And I think, Nolwenn, you can add some more nuance to this. So off you go. Thank you.
Thank you, Mia, for your kind introduction, and Robin for your invitation. So as you said, my presentation or short presentation today is about the gender impact of COVID-19, and is an occasion for me to present the research project I'm currently working on. So I will have to leave at the end of the round table like 4:15 sharp, and I would like to apologize in advance for this. So the pandemic situation and the protection measures implemented around the globe to contain it reveal how people are biologically connected to viral transmission and exposure, but also socially and economically through experiences of confinement, unemployment, uncertainties, and the adoption of new behaviors to protect oneself others, and the health system. Beyond this idea that the virus afflicts us all in the same way, concerns about how it affects people differentially have been raised in the early stages of the pandemic. Individuals and communities, as you just recalled us, are not affected in the same way, neither biologically, personally, socially, nor economically. On the contrary, like a magnifying glass, this new infectious disease highlights health and social inequities, which place poorer countries and specific groups of the population with little economic resources, for example, at greater risk of suffering from the short and long-term consequences of the pandemic situation. One of these differentials concerns gender. Are men and women equal towards viral exposure, transmission, towards protective measures? And if not, how to explain these differences? Are they social, biological, both? If social, what kind of mechanism, what kind of dynamics can explain these differences? So these questions about what makes people vulnerable in pandemic time in regard to transmission and protection is at the origin of a research project that I'm now responsible for, and which focuses on experiences of the pandemic through the lens of living conditions, in order to shed light on how inequalities play out and are reconfigured during this period. So the project is entitled Socio-COVID, Daily Life Experiences of COVID-19, an ethnographic exploration of viral exposure, protective practices, and the making of vulnerabilities through the lens of living condition in Canton de Vaud. It is funded by the SNSF in the National Research Program 78 on COVID-19. It's an interdisciplinary project and rests on a collaboration with Professor Bodenman and Boschu from the University Center of General Medicine and Public Health, Unisanté, Lausanne. So in this project, we adopt a syndemic analytical lens, which refers to an integrative approach relevant to understand how by behavioral, social, economic, and environmental conditions affect health, not as independent variables, but in synergy with each other. And for this project, also, we propose to complement this syndemic conceptual framework by turning to a gender studies intersectional approach, which is an approach which provides a framework for investigating health inequities or equalities, and especially how health differential categories cannot be, it recalls us that they cannot be apprehended as singular variables, independent variables, but that they intersect in complex, multiple and situated ways to exacerbate experiences of illness and health. So the idea is really that the intersection of structural inequalities along the social political domains of race, class, and gender shape living conditions, viral exposure, access to healthcare, and other resources in complex and overlapping ways. So in regard to gender, the literature so far is more, I would say, theoretical than empirical due to the novelty of COVID-19, of course. We could observe many calls or alarm or article saying, let's not forget gender, and here is how we should approach or address it. But there are some now there are also some empirical paper coming out. So for a short review of the literature, it seems that women, in some contexts, women are more confident toward the health authorities in charge of containing the epidemic, more inclined also to adopt appropriate protective practices. And hypotheses advanced to explain that men seem to care less about protection and risk relates to gender norms and the injunction for men to display their strengths and bravery. However, through the gender division of labor, which assigns women with tasks of care and household, they seem really more affected by some of the measures adopted so far to mitigate viral transmission in the population, with the risk of increasing gender inequalities. Especially when we consider confinement, homeschooling, the care of sick persons or other members of the household, it seems that women are really more affected and bear the responsibility of this care. An interesting paper we found is that observed that the salience of care in the perception of risk and pandemic related anxieties. It identifies the salience of care, because when it shows that when men are in charge of this care work, they start also to be as much concerned as women about risk and protection. So from the first review, it seems that immobility and the drawdown of professional and public spheres into the private domestic one, more than mobility, mobility experience of the pandemic, and may play a key role in increasing gender inequalities. For example, in the literature, one can observe many concerns for an increase of domestic violence, especially at the beginning of the pandemic. The lack of mobility is also visible in the reduction of access to sexual and reproductive care due to protective measures, and the reallocation of resources for intensive care units. There are also concerns about a possible regression of women's rights, for example, in regard to abortion in some contexts. In the Swiss context, an example that is interesting is how in the maternity wards of some hospitals in the French part of Switzerland, men or fathers, yes, are excluded from attending the birth of their children, and also women sent at home as soon as possible. And this, increases the idea that women also are the only responsible, or makes them also the only responsible for the well-being of their families and children in this specific moment. So in our project, we explore these dynamics by focusing our attentions on living conditions, that is, on elements that are both outside of people's immediate control, but can nevertheless be modulated or modified by people. We are interested in the material, epistemic, and moral negotiations of risk and protective measures. And there are three groups of the populations involved. So one group is some people of the general population. Another one is the asylum seekers living in institutions, in two institutions, which raise also interesting questions in regard to immobility or mobility. And the third group concerns employee of sectors which were considered to be essential. That is the food industry, cleaning services, transport, and postal services. So this group of persons never cease to work during the pandemic and are exposed through their professional activities to a higher risk of viral exposure. So there are also less privileged groups of the population socioeconomically. So exploring this diverse situation will shed light on or we hope, on the overlapping and the complexity of various kinds of inequalities, gender being not a single variable, but imbricated with other differential, which are in need of qualitative also exploration, and not only epidemiological or statistical exploration. So what we hope also with this project is to put into perspective the epidemiological data that are collected on these three populations in the quantitative part of the project, and to contribute to the development of public health measures which take more into account the situated experiences of people, the impact of the living conditions, and their concern and the unequal effect of protection on people. So far we have already started the research, and we have a few little data. The gender question does not emerge as a huge issue so far, but I think it's also because we haven't enough explored we don't have enough interview and haven't met enough people so far. What emerged instead is really the gap between how people are categorized as at risk and the way they feel themselves at risk or vulnerable. So this is especially visible for people who are in a at-risk category but don't feel at all themselves concerned with risk, and on the other side from people who are not in an at-risk category and feel that they are not taken into account by the medical body, but that they had a very bad experiences of disease. And we can also really observe the practical and the moral negotiation of protection measures taking place depending on the situation of the person. So thank you for your attention, and yeah, I'm glad to hear Priya now.
Thank you for presenting your very interesting project and also giving us an overview of some of the gender findings, or the findings that you've had so far. Priya, over to you now on sort of how this plays out in different areas of the world. Thank you.
Okay, thanks very much. And thank you to the previous two speakers for very interesting presentations. So I will speak a little bit about my work in Bangladesh and India and what's happened to migrants in those two countries in the context of the COVID-related lockdown. So these are, first I'll talk about Bangladeshi migrants in Qatar, which is quite a major destination for migrants from Bangladesh. And there's a kind of increasing trend driven by things like the FIFA football complex, you know, which requires cheap foreign labor to be working on construction sites. So quite a few of these migrants, there are roughly 400,000 Bangladeshi migrants in Qatar. I mean, figures are always problematic here, and more so in the context of irregular migrants, which is what I'm going to be talking about. So out of these estimated 400,000 migrants, quite a few are on the so-called Azad visas. Now, Azad means free, but we'll later discuss how that actually turned out to be anything but free. But actually, before the lockdown happened, Azad visas were very useful for people. I mean, they're basically illegal visas. So what happens is that Qatar has the kafala system. I know that it's recently been modified, but at the time of all of this unfolding in Qatar, that was still in operation. And the kafala system ties migrants to particular employers. And these employers are called kafils. And they agree to kind of, you know, ensure that this migrant works for them. They will issue them with an exit visa as well. So their sort of legal existence in Qatar is tied to this kafil. Now, what brokers in Qatar do, and these brokers are connected backwards through chains of intermediaries all the way to Bangladesh, they bribe the kafils to declare that so-and-so migrant is working for them, get a signature from them, but actually that migrant is not working for them in practice. Now, at normal times, this would have allowed them to get lost in the system, which is what they want. I mean, previous research that I've done among Bangladeshi migrants in Qatar, together with the Refugee and Migratory Populations Research Unit in Dhaka, shows that, in fact, these Azad visas are much sought after. They're more expensive to apply for because they allow people to work for a variety of employers and then move up in the system. You know, they can move from a low paid job to a better paid job to a less precarious occupation, and ultimately even to a proper job with a contract. So this is what a lot of migrants were aspiring to. But in the lockdown, things turned against them because essentially they were irregular in terms of their employment in Qatar. Now, in order to be fully sort of above board, they would have to renew their residence permit, their Qatari ID card, and also their work permit, and that costs money. So some of these migrants haven't bothered with renewing things and were hoping that they could just continue below the radar the way they had always been continuing. And this suited them fine because they were remitting money which was significant for their families back at home. You know, it was a lot more that they would have earned back at home, even though they were employed informally. So they had no work contracts. They had no official sort of status, even as workers in the country. And basically they were irregular in different kinds of ways. And all of that sort of came together during the lockdown. And they were basically invisible, non-existent people as far as the state was concerned, and as far as both governments were concerned, because the Bangladeshi government did try to evacuate its own citizens from Qatar during the lockdown, but that help was extended only to registered workers or people who were there legally. The people who fell through the gaps were these workers on Azad visas, whose permits and every other means of establishing them as legitimate people there had lapsed or expired or become non-valid in some way. So they were immobilized, and they found themselves in a situation of great uncertainty, hyper precarity, and with no assistance from any kind of official source. Even information that they got about the pandemic and how they should, conduct themselves to protect themselves was obtained through their own social networks, through their phones, through contracting friends and relatives. They had to depend on other fellow Bangladeshis who were there legally for, assistance with money and food. And in some cases, their money, the money actually came from their families back at home. So there were kind of reverse remittances happening as well. So this was a situation that they found themselves in, but yet they retained some hope. They were hoping that eventually, things would calm down and they'd once again go back to working in their jobs and be able to earn well. But the uncertainty was starting to really affect them, and they didn't want to go home, even if there was an opportunity to go home, because they would have lost face, and that was a horrible sort of outcome of the migration. So they were prepared to stick it out no matter what, and were just hoping that things would get better. Now, what happened in India was sort of comparable in some ways, in the sense that India has very large numbers of short-term and circular migrants who move from one part of the country to another. So a lot of the workers in informal jobs in urban areas and elsewhere are rural urban migrants. And they typically come from the more disadvantaged regions of the country and from poorer circumstances. And they work in informal sector jobs. They don't have any written contracts. Quite often, they don't have documents with them to prove that they're Indian citizens, to prove that they are migrants who can, call on state benefits if they need to. And in fact, great efforts are made by people who place them, these sort of recruitment agents and brokers, to keep them away from the official system. Because if migrants were employed officially, it would be a sort of financial catastrophe for a lot of the employers, because those migrants would no longer be cheap labor. So they are kept out of the system. And again, in normal times, this was taking over. They were invisible in the sense that they didn't figure on anyone's employment properly, but it didn't matter insofar as they could earn and send money home. But when the lockdown happened, suddenly, all these horrible sort of inequalities and precarities really became evident. And all of a sudden, millions of these short-term, sort of, let's say, undocumented workers emerged from the woodwork, so to speak. They were gathered at train stations and bus stops because, all of a sudden they lost their incomes overnight. Quite often they were thrown out of their places of residence as well, and they were left with no support. And the people who had placed them in these jobs just disappeared. They switched off their phones. And, even though these migrants thought that they had a kind of moral relationship with them, that they could call on a kind of patron-client relationship, it didn't help them. And, they were left with little sources of support, and again, had to rely on their own informal sources of support, many of them embarked on very long and hazardous and dangerous journeys back home on foot, hundreds of miles away from where they were working, simply because they could not access any government support to get them back home, or to, pay them when they'd been trapped in this kind of protracted situation. So they were, without incomes for a couple of months, and then they just decided to take things into their own hands and walk back home. Several people died along the way, and there were hordes of people at train stations. Even government departments were at a loss. They didn't know where these people had come from, which was symptomatic of the problem. They're so hidden and so invisible in official data and databases and employment records, that no one knew who they were, where they'd come from, how many there were in a given place. So it was chaos, and obviously a huge embarrassment to the government, but they just didn't have the means to do anything about it. And of course, there were all kinds of rigid systems of giving people benefits. So they were left out without any source of support. And clearly this shouldn't have happened 70 years after independence, with so welfare programs in the country, but that's what happened. So again, these are people who are, in normal times, kind of treading a fine balance between precarity and vulnerability and survival, and even, improving their own livelihoods over time, was suddenly, pushed back into a situation of hyper precarity, and there were no sources of help for them. So in both case studies, this is what emerges. And the situation of women does deserve some special mention here, because there are, of course, gender differences in the way that people are employed. And some occupations are highly gendered, like care work and garment work as well. And quite often, the jobs that women do are very fragmented in structure and even less visible than men's jobs, because they're not in public spaces. So, for example, garment work can quite often be home-based, and that already introduces so many complexities in terms of the state reaching them for, monitoring their working conditions, or them actually making any demands on the state, because they're isolated as it is, but they're even physically isolated. So spatially, they're kind of fragmented and segregated. And their situation was worse during the lockdown, not just because of their, invisibility, but also because they were having to rely on very sort of random and ways of getting home. And there were reports of, them being sexually exploited on the way. I don't want to say that this came out of our study, but this is what the media was reporting, and I can't say to what extent it's true, but I do know that the jobs that they do place them in more vulnerable situation. That's not to say that those jobs don't help them to also make something of their lives, but during the lockdown, it did exacerbate their situation. So that's all I wanted to say today. Thank you very much.
Thank you very much, Priya, on these new perspectives. This was very interesting. All of you, thank you very much for very stimulating input. And I think there will be lots of questions. So please, if you have any questions, either indicate it in the chat or raise your hand. And then just to remind you that this is being recorded. So if you don't want your face on the video, don't turn on this camera. Let's start with Gianni and Nicole, and we collect a few questions and then go back to the speakers.
Thank you very much for these three very stimulating contributions, which put to me a lot of interrogations. One is basically by a sentence said by Lorenzo, and I would like all of you to reflect on this, because hearing Priya's contribution, I have my doubts. When Lorenzo said that basically migration or the migrant status is not a central category, I bought it immediately. Obviously, they're comparing Lorenzo's career with a housemaid from the Philippines in Rome is completely something different. But in listening you, Priya, I had the impression that nevertheless, the status of being a migrant is interlocked with other categories which are so important, and not being migrant, irregular or regular, would have caused a completely different path to all these people. So what is really the status of being someone who has traveled over a border, domestic or international, living in another space, and being not part of the community you live in, and has to basically find its place, her place, his place? Thank you.
Thank you, Gianni. Nicole, we'll take your question as well, and then we'll go back to the speakers.
I think I was intrigued by the same comment that Lorenzo made in his work, and I was actually wondering at Nolwenn in her research. I mean, what do you actually see, or do you have any indications on how important migratory status is in the context that we're talking about?
Thank you. Shall we start with Nolwenn and Priya and Lorenzo? You're muted, Nolwenn. Nolwenn, you're muted still.
Oh, thank you for your questions. But just, Nicole, what was your? Could you repeat just the indicator of the status of?
No, just really, if you saw in your empirical data whether migration background played a role or not. So do you have any indications on whether it was relevant or not?
Yeah, thank you. Just in our research, there is this group of the population which are these asylum seekers, but the situation is very specific in the sense that they are residents of institutions, and perhaps the specificity of their experience there was really this increase of immobility, but not in the how do you say, the private space, the domestic space, but it is institution where they wait somehow for legal status or their situation to be regulated or clarified legally. And what was interesting for us is that from an epidemiological point of view, in the two institutions we investigated that are taken into account, there were high differences of contamination, for example. So then it's interesting to see how what is different in these two institutions. It's not population related, but what is or is it, or what made these differences. But I'm not sure it answers your questions, because it then, for example, they realize that the habit of going outside for smoking is a space, a moment which is much needed when you live in an institution with a lot of other people in a very small space, and but nevertheless was a moment where contamination, where probably there were higher rates of contamination. But it doesn't answer probably your question about this broader question of migration and mobility or immobility. And as I'm not a migration specialist, so I'm not sure I can answer more than what is in our empirical research. But perhaps the things that is really of concerns for the physician, the doctor, the public health experts I work with is the trust. It's perhaps a question for you also, who are more specialists in migration, but they have their concern or their observation that these population went through so much bad experiences with the state that they cannot trust it anymore, that they have a really lack of confidence in the institution, and nevertheless they seem to really do their best to apply this protection measure that restrict their daily lives in significant ways. And perhaps this is also interesting I have a colleague wanting to go deeper in this question. Yeah.
Or do you have? Sorry, I didn't want to interrupt it. Yeah, you.
No, I would just wanted to see Nicole say, if this is what you had in mind, or did you have a more specific?
Oh, perfect. I think you teased out the direction in which I thought probably you would have found it, because of course Mr. Boldman has worked quite a lot also on those areas.
Exactly.
That's why I thought that he probably would not be completely blind to these issues. So yeah, that's why I raised it. Thank you very much. Perfect for me.
Okay, do you want to comment on the question?
Okay. Well, let me see if I've understood the question properly. But if I understood it correctly, you were asking if being migrant is the main determinant of the kind of vulnerabilities that we're talking about here, vis-a-vis non-migrant populations. So I'd say that the situation is different for the two countries that I've discussed, because in Qatar, probably yes, because the kind of native Qataris are in relatively less precarious situations than migrant populations are, for a variety of reasons. You know, they have very strict regulations on the way that migrants are treated. They're not allowed to integrate, really. You know, they're on very sort of tightly sort of orchestrated visas where they do their work and get out after a couple of years, essentially. And if anything goes wrong, they are in a precarious situation. And of course, if they are irregular, more so. But in India, it's different. You know, there are a number of non-migrant groups who are equally vulnerable, I'd say, in a situation like this. I mean, for example, the resident urban poor or the resident people anywhere who lost their jobs because of the lockdown. And there are, 91% of India's workforce is in the informal sector. So when the lockdown happened, all of these people, most of these people, were suddenly without an income and with very little source of support, because they weren't allowed to trade in the streets, for example. They weren't allowed to sort of sell their wares or travel around and do the things that they needed to do to earn their living. So in that case, no, migration is not the major determinant, or migrant status is not the major determinant. But of course, if you're undocumented internally, it's much worse, because then you really have no source of official support whatsoever because you're not resident there and you're not officially recognized as a migrant who can call on support through the laws meant for migrants. So that's all I could say in response to that question. And I think both Nicole and Gianni asked more or less the same question.
Thank you. Lorenzo, do you have anything to add? Do you want to comment? They were challenging your son.
Just very quickly, I think there were some migrants who were very strongly affected by the pandemic precisely because of what Priya was saying, because of the lack of documents or because they were not recognized yet in the place where they were traveling. We have all read very dramatic reports on asylum seekers stuck either in camps, the news of this week, I think, what was happening in Bosnia, and earlier on in Greece, and earlier on the border between Mexico and the US. Those are tragic situations and are due precisely to the fact that these people are migrating. But again, we should really differentiate between different groups of migrants. And I find very much unease when I read that migrants are badly affected, because I am a migrant. There are engineers in Zurich who are migrants and arguably had a great time during the pandemic. And if I may, I was really fascinated by the presentation of Priya, because when I was writing this report, I remember clearly reading this, it's not a statement, another report by the International Labour Organization that was saying that in Qatar, the authorities ensured that all foreigners had access to testing and hospitalization and to the full salary, even if they were placed in quarantine. And clearly you show that, what we read on paper, it's true, which brings back to what Piao was asking in the earlier presentation that we did. We did this massive data set on travel restrictions, but then we had no idea what is the actual situation. One thing is what authorities say that they will do, and quite another is what happens on the ground. Maybe that's why I'm a big fan of qualitative studies, because you really see those things, whereas in quantitative, you try to paint a big picture, but then you have to take it with a pinch of salt.
Yes, I agree. There were a lot of complexities that came out, and it's very nice to also look at these complexities as such. Does anybody else have a question for our speakers? If not, then I have one, because I read your things before, and I also listened to your presentations. And for me, a lot of questions popped into my head, but maybe just as a brief parenthesis before, my own research focuses on how we want to share the welfare state with migrants, just that. And so I think in this case, it's very interesting to look at specifically that. And I think you mentioned it in a few places, the access to healthcare, the access to social rights. And for me, we did a survey experiment in Switzerland, and we asked people who they want to share with, basically focusing on self-employed and also focusing on undeclared self-employed. So specifically that category that came up in a few contexts. And there we saw a clear sort of lower deservingness of these migrants or these people. And then also migrants were less deserving than Swiss for the access to state support for their business. And for me, this sort of, I don't want to say this contradiction between sort of using a lot of this undeclared work and in Qatar to build the stadiums and so on and so forth, to then see how they're then excluded when it comes to sort of taking care of them is always quite puzzling, or not puzzling, astonishing. And these systems, the way they've been working, they have been working for someone. There's always someone who is benefiting the way the system is set up. And for me, now the question is, now that we see it, in a way, COVID has been very brutal in showing all of these inequalities and showing these discrepancies also in the context of gender, but also in migration, and especially these complexities. Because in Geneva, where I live, we had a lot of migrant, mostly women and care workers who are the nannies and the carers of the population here, but who are undeclared, who then didn't have enough money to buy food, who were then benefits of food banks. So how do you see this going forward? Like, has this been the big awakening, and how can we sort of learn lessons from this? Or do you think there will not be any lessons? Because I think Priya, in the blog post you shared, there was this mention of, okay, but then afterwards they will have to build the stadia for the World Cup. And then does that mean that basically the same system will continue with just more workers coming under that same visa and so on and so forth? So just a few comments maybe on that.
I'm happy to respond to that. I mean, the places where I've worked, I'd say that, you know, governments are making efforts to do things differently. But the thing is that, you know, that these exploitation or exploitative relationships are situated or grounded in traditional systems of exploitation and inequality in South Asia, at least. And it's actually very difficult to break them. And they do infuse all institutions, including government. So, you know, it does require there to be quite a fundamental shift in the way that labor is organized, you know, not just migrant labor. And also, I mean, there has been some improvement in workers' rights. I mean, they have mobilized by themselves with the help of others, you know, wages have gone up in some places. So there are some shifts. The thing is that there aren't major enough shifts. And of course, until and unless there is a kind of change in the circumstances where they come from, this kind of thing will continue. And even then, it may continue even then, because, you know, this is the old sort of development and migration debate. You know, will development halt migration? Well, it probably won't, because it creates new kinds of aspirations as well. I mean, this kind of grinding work in the informal sector can also be aspirational, believe it or not. I mean, that's what some of my research at the moment is looking into. You know, even though the work to us, you know, sitting in our comfortable offices may seem like absolutely the pits and something that no one would ever want to do, it can be seen as a step on to something different and better. So, you know, even that can be aspirational and can continue even if the conditions improve in rural areas. So I think, you know, change will need to happen at a variety of levels. And there are discussions happening. I mean, I'm deeply involved in those discussions myself. You know, I've been talking to a lot of government officials in India and academics and NGOs. And all of a sudden, you know, there's lots of interest in this issue. Which is about time. You know, it had kind of died down after the 80s, but once again, this whole sort of debacle has made people look at it seriously. So I'm hoping that they do something about it, but the context isn't favorable, because as this is all being discussed, you know, at the same time, the kind of neoliberal trends are strengthening, if anything else. You know, labor laws are being diluted as we speak. I mean, they haven't quite happened yet, I think, but they could well bring in some, you know, new legislation which will further dilute the rights of workers and laborers. So, you know, one must sort of bear in mind these kinds of shifts in policies and the politics of labor as well. So, yes, I'm sort of hopeful, but at the same time pessimistic as well. I can't. It's a very sort of complicated answer I've given you here, but basically I don't have any simple answers to that question.
It's a difficult question, so I don't think the answer can be simple. Thank you, though, for trying. And, yeah. Does anybody else want to comment or have any questions?
Can I have just...
Go ahead, yeah.
Oh, yeah, hi. Hello, Priya. Nice to see you here after so many years. I was just thinking, the title, Inequality and the COVID and Migration, is a really interesting topic. Probably we do need a kind of broader framework, which can also follow Lorenzo's comment. If you look at the human history, all the horrible things, Black Death, plague, wars, are all very good for equalities. And I mean, we would not have these welfare states without the two terrible world wars. And of course, the Black Death was wonderful in a way. So many people died, and precisely because of that, so the value of labor was appreciated. Many people were freed. So if we put in the larger scheme of things, my sense is that this COVID probably could be a minor correction to inequality. But a far more important question than this is, then why inequalities have becoming so bad? Inequality, if you look at the US, where the data is most systematic and comprehensive, we know that the inequality become worse and worse since the early 1970s till even today. I mean, from 1970s onwards, it's supposed to be golden time of capitalism. Everyone were happy. And by that time, the manual workers, I mean, the working class income in terms of real value did not increase, while the total productivity level increased extraordinarily. And we know the 1%, the top 1%, reap most of the benefit. Similar situation in Europe. So inequality happens under liberal discourse during happy time when everyone is drinking and dancing. So this is really, we have to think of the, I mean, it's a little hard for academics. We are primarily part of this liberal bloc. I mean, we're waving the flags of human rights, equal rights, etc. But we know the horrible inequalities taking place while these discourses really reach a high level. Donald Trump, I mean, did a good thing in a way because it wake people up to some extent, and we realize how horrible situation has become. And these people cannot express their own ideals other than taking quite extreme, brutal, and actions. That means a similar situation in other parts of the world as well. So, I mean, that is I don't know. I mean, it's probably there is also a question whether or not the social sciences have becoming too, I wouldn't say too technical, because we do need actually deeper, get more concrete data and etc. But somehow the discussion sometimes are trapped by certain discourse that prevent us, on one hand, from going deeper to get all this concrete data, and on the other hand, prevent us from going higher level, look at the larger history. I mean, I don't know, this is probably not appropriate comments. I just basically to say that if you look at the histories, all the wars and pandemics have been doing, have some tragically benefits to human society. That's all what I want to say. Thank you.
Okay, thank you. Let's take this as a final note for our little round table, because I'm mindful of the time and I think Nolwenn has to leave us. So thank you, everyone. I think we have enough food for thought. There's lots of, at least in my head, still questions that remain. And thank you to our speakers. Thank you, Robin, for organizing this. And I hope you all have a wonderful weekend.